Thank you for joining us for Ask a Therapist, a Blue Cross Blue Shield of South Carolina series in which we speak with mental health professionals about issues many people face every day. Today, we are joined by Dr. Jennifer Heath, a child and adolescent psychiatrist and medical director here at Blue Cross. We are talking about teens and smoking. What are some of the reasons why teens smoking should be a concern for parents? Like, why is it something that should be addressed?
There's a very huge and negative impact on mental health and physical health for teens when it comes to vaping or smoking. Short term, the use of the e-cigarettes can lead to nicotine dependence and the potential for withdrawal symptoms if they try to stop. Teens seem to be more sensitive to nicotine and its effects, and so they will be more likely to feel dependent on it quicker than adults. Short term, also, the vapor from e-cigarettes can irritate the lungs and the throat and make it easier for teens to get sick from cold and flu viruses. And also can lead to concerns about some cognitive impairment, having trouble with attention, concentration. Those are all things that can be short-term. Long-term, the adolescent brain is still developing, and using nicotine can affect the development of the brain, can affect the dopamine reward pathways, that might make teens more susceptible to other addictions, to other substances in the future. As I mentioned, since the brain's developing, it can have just a negative impact on overall brain development that could lead to an increase in behavioral problems or impulse control and difficulty learning.
Oh, and what's that link between like vaping and the mental health side, like anxiety, depression, or other mental health disorders?
So we already said that anxiety and depression are kind of a risk factor to start vaping. And so they've also found that vaping can actually worsen depression and anxiety. So when teenagers might start smoking or start using vapes to help with, they feel like it helps relieve stress. And once they start vaping, there may be some validity to feeling like it might be helpful, because once you start smoking or using nicotine products, you can then have withdrawal symptoms. And those withdrawal symptoms could be irritability, restlessness, sadness, anxiety, fatigue, difficulty concentrating. And so then you feel the need to use it again, and it will relieve those because what you're experiencing are the withdrawal symptoms. But that's probably one way that people can get addicted, is because when it gets out of their system, they can feel really bad mentally and physically. And just as far as what we mentioned earlier, it can affect their attention and lead to difficulty in school, which that could lead to an increase in anxiety and depression in teenagers. And if they become addicted to the nicotine, quitting can be difficult. And the addiction to the nicotine can really affect how they feel, can really affect their thought process, and have an overall negative effect on health.
What about the effect on social relationships? Does vaping have an impact there?
It can. So if a teen starts vaping, maybe because of feeling stressed or anxious, and not really because their friends do. Their friends may frown upon it, and they may feel bad or feel like they need to hide things from their friends. So that's going to affect those relationships. It may lead to them spending more time with peers who also vape or, smoke, and that would kind of feed into continuing to use the nicotine products. If they started using with friends, then they may have the pressure to continue using the cigarettes or e-cigarettes to maintain those social connections for fear that they may lose friends if they stop vaping. And then kind of like a circle or a spiral that if then they start feeling more depressed or anxious, that could also lead to difficulty maintaining friendships.
Moving on to like how to help, right? So what are like some of the signs that parents can look for um, to potentially identify mental health issues related to vaping or that your kids might be vaping?
Sure. Any significant change in behavior in your child can indicate either mental health issues or substance use issue, whether it's vaping or any other substances. So you want to watch and see if your teen becomes more withdrawn, isolated, irritable, they seem more impulsive or moody. That could all indicate that something's going on. And that's when you should just gently start asking questions and checking in. As far as kind of signs that they might be vaping, the e-cigarettes kind of come in all shapes and sizes and can be pretty secretive as far as not really knowing what they are. They can look like there's something related to your computer and so trying to be aware of if you find something you're not sure what it is, looking into it, looking it up, learning about e-cigarettes, being educated yourself about what e-cigarettes look like, what they can do. If your teen, if you notice a fruity smell around your teen a lot, the e-cigarettes don't have the typical traditional cigarette smell that people are used to and can spot. So it's more subtle and it's easier to miss. So just being aware of any kind of changes or if they seem more secretive, that would kind of lead you to know that there might be an issue.
Did parents try to address vaping and cigarette use before, or is it something, you talk about if you notice a problem?
Both, right? So you should address it early on before it's a problem. I think a lot of parents might be afraid to talk to their kids about different issues, whether it's tobacco, vaping, or other drugs, for fear that if we talk about it, then it'll give them an idea to do it. But it's out there. It's in society. Their friends are doing it. They're going to be exposed to it. So it's better, as we mentioned earlier, middle schoolers are using e-cigarettes. So it's better to start early. As I mentioned, 4th, 5th grade, depending on your child. Every parent knows their child better as to what would be appropriate to share. But just starting general conversations about what vaping is, what's in the vaping, what it can do, just very general things early on, and then continuing that conversation into middle school, and definitely into high school. And then if you notice some of the things we just talked about, some of the signs, then just approaching it in a very open and non-judgmental way with your team, saying, hey, I've noticed this, something going on. Is there something you need help with? And approaching it that way.
What are some like tips or advice for parents and how to communicate with their teens about these issues?
As I mentioned, being very direct and non-judgmental about vaping and nicotine use, setting clear rules and expectations early on. As far as, since we talked about the earlier, the better, whatever you feel like your child can handle. I think it's important to highlight the harm that some of the e-cigarettes can cause, and that they're very addictive, and it can become a serious problem for the teen that they might have difficulty stopping using. When you're talking to teenagers, it's sometimes better to focus on short-term risk and more concrete things because they don't always see the future. As far as we know that it increases the risk of cancer, but that's not something that they would think about right away. So, perhaps focusing on, it could increase your risk of being sick more frequently. It can affect your lungs and make you have trouble breathing and just doing the things that you like to do. Things like that are very now focused If it is impacting their friendships, talking about how it's impacting friends, and how it could be impacting other relationships.
Are there evidence-based interventions or treatment programs available for teens that are struggling with vaping addiction?
Yes, fortunately, there are several programs and different types of interventions to help teens with all kinds of nicotine addiction. Over the past, say, probably maybe decade, it's become more and more evident that teens are even turning to e-cigarettes first before trying anything else. So more research has gone into what can we do to help teens who do become truly addicted, because they can. As I mentioned, they're more susceptible to becoming addicted. So there are different text-based programs one is called Smoke-Free Text for Teens, and it's for teens ages 13 to 17 to help them quit smoking. They can go on a website or text the word quit to 47848, and they'll get daily text messages to support quitting. So it's a kind of a very, focused program for teenagers. There are also state quit lines, so 1-800 numbers that teenagers can call and get a coach to help them learn how to quit. And that's 1-800-QUIT-NOW. So that's also an avenue to get very focused help for quitting. And there are a lot of, so like mobile phone, different app-based programs specifically geared to help teens quit smoking, because it has become such an issue.
Wow. Is there anything else that you want people to know?
I think, as we talked about, just, talking to your kids about peer pressure, about how to handle when somebody asks them, not just about vaping, but even if it's any other substance. If your teen comes to you and says, "Hey, my friend is vaping, what do I do?" You could even offer to role play with them and say, practice how they can say no, practice what they can do to get out of situations that are uncomfortable. If they say, "Hey, I'm vaping because I'm feeling anxious or depressed," then that's your opportunity to really get them some support by finding them a therapist or a psychiatrist or whoever they need to see to help address the mental health concerns. So that would decrease their risk of becoming addicted to the vaping.
Great. Well, thank you so much for joining us today.
Thank you.
This conversation about mental health and getting help is incredibly important. We hope this discussion can help you or someone you know. Blue Cross Blue Shield of South Carolina members can call the number on the back of your insurance card for mental health resources. We hope you'll join us again for our next Ask a Therapist podcast.